Dan Koboldt is with me now. He's moderating a session at ASHG about retinal disease genetics.
That's right.
This sounds really interesting. I'm fascinated by the eye. So tell me first off, what is the current state of research in inherited retinal diseases?
Well, there's really two forms. I mean, if you're working on the front of the eye or the back of the eye. And the session that we have tomorrow is about diseases that affect the back of the eye, like the retina. So it's been a really exciting time because a lot of those have a genetic component. And with these advances in sequencing technologies, we've made a lot of progress over the past 10 years, especially in identifying what genes and mutations are involved in eye diseases and seeing if there's new ways to treat them, because there's not many good treatments for a lot of inherited retinal diseases.
How can these findings be applied outside of IRDs?
Well, I think that retinal diseases make a good sort of case study for using genomic information to improve clinical care, because they're very heterogeneous. There's lots of different forms of disease. Sometimes they affect just the eye, sometimes they affect other parts of the body, and there are lots of different inheritance modes like dominant or recessive or X-linked. So it's a very diverse disease from that point of view, and it gives us the opportunity to tackle it from a few different angles. So we've discovered upwards of 250 genes that are involved in inherited retinal diseases, and now is when we're starting to really translate those findings into potential therapies down the road.
So it's one thing to explain this all to me, but what do you hope attendees take away from the session?
Well, I think it'll be a good opportunity to learn about the state of the field of inherited retinal diseases and recent discoveries. Steve Dager, our first speaker from the University of Texas, is going to cover that and give a really nice overview. And then we're going to talk a little bit about the counseling and clinical care for RP patients from their point of view. That's with Carrie Branham, who's a genetic counselor from the University of Michigan. And then we're going to have Val Sheffield from University of Iowa, who's really at the forefront of some of these new therapies like stem cell approaches to treating retinal diseases. And finally, we're going to have Eric Pierce from the Massachusetts Eye and Ear Institute talk about kind of the future and what's going on in clinical trials and how are we going to treat these diseases.
You've got all angles covered.
Right, it's going to be a start to finish, and even though this is about eye diseases, I think it's applicable to a lot of inherited diseases where we're looking to use genomics to eventually improve care and treatment of people that have those diseases.
Absolutely. Well, thank you so much for sitting down with us and chatting with us.
Oh, it's my pleasure.
Enjoy the rest of the annual meeting.
Thank you.